All right. Hi, good evening, guys. Good morning if you're in Philippines, and good evening if you are in United States of America. For my friends in United Arab Emirates and Saudi Arabia, Salam Alaikum. It's me, Dr. Jenny, physical therapist and doctor of physical therapy, certified exercise expert in aging adults, and geriatric clinical specialist. And we are here with you right now for our podcast, for our Balance and Flow support group, and for the Thanks God It's Thursday. For some of you not familiar, Thanks God It's Thursday is part of our Balance and Flow support group. Every Thursday, we featured and we interviewed different kinds of therapists. They can be innovators, academicians, inventors, slash scientists, and also researchers. And we will going to know more about them and ask how's their journey. And tonight, for our Thanks God It's Thursday, we have another great physical therapist, and she's originally in Vermont. So she's in Vermont right now, but she is originally in Austria. All right. It's really unique. She is pure Czech, but I'm so glad to meet her and know more about her. We are classmates. I call her classmates in CEEAA back in 2015. And we both passed our geriatric clinical specialty exam that time. And we are so fortunate to meet each other back right now. Without further ado, everyone, I would like to present to you with her time. I know it's very precious. She's doing her PhD and also her master's in public health right now. She used to be the chair of the Balance and Force Special Interest Group in Academy and also the Jerry Edge, the fall risk. So she's the chairman of that. And now she set aside some of those leadership because she wants to study more and help more of our clients. And she's also the program director of the Evidence in Motion for the geriatric specialty. All right, welcome guys. Let's welcome Mariana Wingood. Welcome, Mariana.
Hello, thank you so much for that introduction. That was so kind of you. And I love that you call us classmates. It just makes me so happy. Yeah. And we truly are. It's like we started this journey together of continued growth, and each of us have been growing in our own way. And I know you love it and I love it. Just, making ourselves better every day we can. And I'm very happy to be here with you today. So thank you for this opportunity.
You are welcome. Yeah, we are like really students that day, right? We're just listening. They are Jill, Kathy, and all the rest of the instructors for the CEEAA. And I'm so glad because I met many different wonderful therapists that day. Do you know that we also have another classmate, we call it Janelle? Shout out to Janelle Torillo. He is now the director of one. He's a director, administrator of one skilled nursing facility. So how awesome is that, right?
Yeah.
He's nursing and doing his physical therapy and nursing, also masters. And that's why now he's director. We really evolve a lot. So back to you, Mariana. So how are you? I know you're in Vermont right now.
Correct. Yeah, I am great. So I actually just finished my MPH and PhD. I finished both of those degrees this last week. So I am like ecstatic and in a much better place than I was when I was doing both of those degrees a month ago. But I am really good. It's really nice to, initially I was really sad to leave clinical practice full time because I just love my patients. But I wanted to pursue a PhD because I wanted to figure out what we can do to decrease the gap between research and clinical practice. I wanted to make sure our patients get the best care that they really deserve. So I decided to go get my PhD, and I love it. I just love being able to not only identify the problems in clinics, the barriers that clinicians have, but also addressing those barriers to find solutions so we can practice at the best level we can. And I love teaching. I just love seeing that growth in the students and the excitement that they have, that fresh, just ready to go, and uncertain of what will happen, and being there to, comfort them and make sure that they feel confident going into clinicals and then into their own practice.
Exactly. Yeah. So I was amazed. That's really very difficult, doing masters in public health and PhD at the same time. Some of them they do it one, but I'm sure there's an overlapping. Maybe that's why you do it at the same time. So what's the challenge there?
Yeah,
Challenges.
it's definitely, I wouldn't recommend it to most people. There's sleepless nights and, many things that I had to let go because of that. Like you mentioned, I was the balance and fall sick chair. I had to pass that torch to someone else, not because I wanted to, but because I just needed to make sure I had time to sleep and do other things besides working all the time. So time was really the biggest challenge. And for me, it just made sense because not only is my research addressing gaps within clinical practice, but I also focus on primary prevention and really promoting that within physical therapy. Because I'm a true believer that as physical therapists, we have the power to provide physical activity prescriptions and nutritional support and sleep hygiene support to our older adult patients that can prevent things down the line, and work with our community partners and public health officials to really work as one team to address those issues. So it just really fit well into the puzzle that some of those sleepless nights were fully worth it. And I'm really happy with the fact that I did it.
So congratulations, Dr. Mariana Wingood.
Thank
So
you.
you're not only a doctor of physical therapy, you now have your PhD. I know your dissertation is really, that's the sleepless night, right? And now
Yeah.
you are also done with your master in public health. So that's really amazing. I think what will be the best skill that a therapist or a clinician should have if they want to transition in this journey?
Yeah. So one of the reasons I ended up adding the MPH to my PhD is because before I got my PhD, I always liked research, or I thought I liked research. But I wasn't certain because when I was in PT school, I actually struggled with research a lot. It was really challenging for me. And I just didn't think I was smart enough to do the research. So I took some biostat classes and epidemiology classes and really public health related classes to see if maybe I am smarter than I thought in PT school and that I could do it. So I kind of exposed myself through that. And then when I joined GeriAtch initially, it's funny, I will never forget the day I was sitting in my first balance and fall sick meeting as a member, and Mindy Renthrow, said, hey, we're starting this group called GeriAtch, and we're looking for individuals with research experience who want to join. And at the end, I was like, well, I have absolutely zero research experience, but I'm really interested in learning and joining. And that was the other piece that really sparked my interest. And I think saying yes to that one project where I really was passionate about it, but not certain if I could do it, was the best thing I've ever done in my life. And just stepping out of that comfort zone to follow your heart is really the key to it all. Because I was just reflecting today, if someone told me 10 years ago or even 5 years ago that I was going to get a PhD and then go do a postdoc, I would have laughed at them and said, there's no way I could ever do that.
Wow, that's
And
really
here I
good.
am.
Mhm. That's really good. You'll never know until you touch the water, something like that,
Yeah, yeah.
They said, and also the biggest change is always like trying, just trying until you know that you're able to do it. And also that's really good when you say that, be out of your comfort zone, because you will never have a growth when there's no change.
Yeah,
And
yeah.
then
I
I
fully
like when you
agree.
say, when you are comfortable it means there's no growth or improvement on that. So that's really good indicator that you're doing something, right?
Yeah.
That's
Yeah.
really awesome. That's really good. That's really good. And I also know Mindy,
Mhm.
Mindy, and we love your work, guys, because I saw some of the research, and then there's some like false prevention whenever I'm sharing and doing some courses and do sharing for the team. And then I see your name and Mindy. I said, "Oh, this is your work you're talking about." So that's really good. And I believe Jennifer Vincenzo right now is the chairman, and
Yeah.
also wonderful articles. And I like when you say you'll never know that you will be liking or loving research.
Yeah. You sometimes you just don't know. And sometimes your first experience with it may have not been the best one because maybe it wasn't taught in a way that worked for you. It's not that you're not good at it, it's just that it wasn't presented in a way that is clear to you. And I think that's really important to know.
Yeah, and congratulations, you're also the program director and then also the EIM, Evidence in Motion. I have some friends there in the Academy of Filipino American Physical Therapists, and I heard lots of great thing about EIM, and they have also, I love the teachings and also Childs, I believe
Mhm. Yeah,
your
John
group,
Childs.
wonderful, John Child.
Yeah.
So tell us more. How does it work as a program director, and how many years? Is it 2.5 years as well, like the others?
Yeah.
Transitional DPT.
Yeah, for for transitional DPT, it's about 2 years. So students usually, or participants, I should say, choose to do a geriatric certification or specialize kind of in geriatric field area, and then they have the TDPT added, the transitional DPT added to their program. And what I love about EIM is that we are meant for kind of busy clinicians. So you're only taking one class at a time so you don't get as overwhelmed. And we really work with our clinicians to make it what works for them. If they need a little bit of a break, we'll figure out a way to put a little break in. I mean, COVID was a perfect example. So many individuals and clinicians were just really overwhelmed by COVID and everything that was happening. And I reached out to a couple individuals who I could tell their grades weren't really where they used to be. And I would just talk to them, hey, I know this is a really hard time. If you would like, we could pause the program for you for a little bit, and then we continue at a time that works for you. And all of them, they were so appreciative that that was an option. And I'm like, EIM is all about that flexibility of working. What works for you is really what we want to provide. And so they all have come back in the last few months and are now finishing up. So the length of the time really depends on the individual, but in general, it's about 1.5 years.
Oh, okay. Yeah, because I also have my TDPT in
Mhm.
University of Montana, and they are around 2 years as well. And but you, as what you've said, it depends. I totally agree with you. It depends on the student if they want to pause, and then at least that's the flexibility option there, right?
Mhm.
And they are all working. They
Yeah.
are they are also maybe how about finances wise,
Yeah.
financially you shoulder on your own, and this is we're paying on out of pocket. We usually don't do loans sometimes with this option, so
Mhm.
that's really important as well factor for that. That's really
Yeah.
good. And I
Yeah.
believe we have practical too, right? A practical class, not everything is like online.
Correct. Yeah. So we have 2 weekend intensive classes where people meet in person for the weekend. One is a balance and falls one, and the other one is a musculoskeletal manual therapy one.
That's really good. If we keep talking right now, Mariana, we keep talking about balance, falls, and we always love falls risk assessment, falls prevention. Why do you think to all who's listening right now, why do you think we are really focusing in improving balance and preventing falls?
There's so many reasons to, improve balance and prevent falls. But I think the number one is for the safety of our patients. And really, if you ask patients, there's few things that they really like in life. One is to stay independent and stay doing the activities that they have always enjoyed. And part of that is fall prevention and just keeping individuals active in general. But as physical therapists, we really have the power to prevent something before it happens. And I think that's really important. And sometimes we don't start that journey early enough. I always say everyone should be working on their balance. It doesn't matter if they're 12 years old, 20 years old, or if they're 110 years old. Balance is an important piece of our life, and we really need it for all aspects that we do. And then there's other factors related to things that happen when you have a fall. May not be a hip fracture or something else. But if we have the power to prevent something, why not do it?
Exactly. Yeah, so that's really good. And if you will ask guys, also Mariana is a very good speaker. She's an educator, and there are some lots of works in MedBridge, right? Is it still there, Mariana?
Yeah. Michelle Lusardi and I, that was such an honor to get to work with her, put together a MedBridge course a few years ago, and it is still out there.
Yes. So she is in MedBridge, and she is also a clinician in University of Vermont or Medical Center. And how can we connect with you, Mariana, if ever there will be clinicians out there would like to go on your path, like on a PhD or thinking between MPH or maybe MBA? We
Yeah.
have physical therapists doing business administration, So if they want to get some advice with you, how can we connect with you?
Yeah, I am happy to connect with anyone, because I feel like I had to connect with a lot of people when I was trying to make that decision. And boy, I am forever thankful to all my mentors and peers that I got to talk to. So I'm happy to talk to people. The best way of reaching me is either by my email, which is my first name dot last name, so Mariana.Wingood at outlook.com. Or I am on Twitter, which I check pretty regularly. And my Twitter handle is Elevating EBP.
Oh, I like that. Elevating evidence-based practice. And that's really good. That's really good. And that's what you're doing right now.
That is my goal.
Yeah, that's really good. And that's the reason why you want yourself to be better from your previous one. And that's also my philosophy. Mariana, how many years are you now in America?
I moved to America in 99. So gosh, I can't do the math right on the spot.
Yeah.
So quite a while.
For me, I'm only here 9 years.
Oh, wow.
Yeah, I'm only here 9 years. And when I joined, when I have my first job, I enjoyed attending courses. I keep attending courses, and then they said, "Why you keep attending courses? Because that's how you learn, right?" And then, how can you deliver a better and a quality treatment, evidence-based practice, as you've said, treatment on your clients if you yourself doesn't know something. We are not stuck on the typical HMP 10s and doing these exercises, because there are more to give.
Yeah.
And that's really important. Yeah.
And what I love about physical therapy and healthcare in general, it is constantly changing and improving. So people like you and I who are thirsty for knowledge, and those courses, it's meant for us, because you have to kind of keep up, else you're not doing the best you can for your patients. And really, or clients, and in the end they're the ones that are benefiting from you and I going to classes or courses all the time and bettering ourselves.
Exactly.
Yeah.
That's really good. And thank you so much for this opportunity that you squeeze us in your very busy schedule. So right now you're done with your PhD and you're done with your MPH. What's the next thing with Dr. Mariana?
Yeah, so I am really excited. Next month, I start a postdoctoral fellowship. It's the Advanced Geriatric Fellowship through the VA system.
Okay.
And I'm also doing my research is on implementation science. So I also have a postdoctoral fellowship through the Academy Health related to health service research.
Wow, that's really deep. We can't
Yeah.
we can't reach you.
Oh, I'll still be there.
All right, that's really amazing. Thank you so much. And we always ask this with our guys. So how do you make yourself move? Like what keeps you moving? That's what I want to say.
What keeps me moving? I think it's two different things. What
Yes.
keeps me moving in the sense of being educated is really my patients and the older adults. I went into this profession because my grandma was the one that raised me and I never had the opportunity to thank her. So this is my opportunity to thank all older adults for all that they have done for our society and all that are younger. So that's really what keeps me moving in that sense. And for physical activity wise, what keeps me moving and active, I'm a little competitive and I like winning. So to keep winning races, I have to keep moving.
Okay. And I think you're like an athlete. I think do you run? I think you
Yeah.
like to run or
Yeah. I compete in ultra marathons and
That's
Ironmans.
what
So.
I remember. Yes, that's what I remember. You're doing something last time before you do your PhD. You're in a marathon something that time. And
Yeah.
I heard your dog. What's the name again of your
Yeah,
dog?
I am so sorry for my dogs barking. Um, it's Moose and Carl. I have
Is it
two.
two? I thought only one. Okay.
Yeah, I have two greater Swiss mountain dogs and they each weigh 125 pounds.
Yeah, they're
And
bigger than you.
they are bigger than me. They're my
Yes.
cuddle bugs, as I
Yes,
call them.
that's what I remember. You said that you love to move with them, you walk with them, and that's why I remember. I didn't know that it's two. So that's
Yeah.
right. So thank you so much, Mariana. We really appreciate this time and also getting to know you more. And I really appreciate you sharing with us and to our listeners how important knowing to prevent falls. And now we are doing more on falls preparedness and not only preventing it because everybody are at risk of fall, right?
Yeah.
We are can be high risk, but you're still at risk. So we really appreciate your knowledge, all your time in doing the research because it will benefit all of us clinicians and also our clients. So any last message for us?
No,
Anything?
I just want to thank you for this opportunity and for you doing this. This is so great. And I think you're sending so many important messages out to your listeners. And I think together we're going to keep doing better than the day before. And hopefully you will motivate others to keep improving themselves and to be the best that they can be for our patients and clients that we see.
Oh, that's wonderful message. Thank you as well. And you're welcome, Mariana. Dr. Mariana Wingood, guys, is in the house. So thank you so much. We learned wonderful things from her, how she transitioned from clinician in PhD and MPH, and now she's doing more above it, the fellowship, So this is like a typical, like, if you want something, just keep going and you are I love the term like when you say Dr. Mariana, you're thirsty for knowledge. Yes, guys, we really need to be thirsty because that way we improve ourselves from our previous self. We are competitive in such a way we compete in our Jenny 2000, and now you are Jenny 2.0. It's something like that, 2.1. So it's not always. You don't compete with other people's journey because that's their journey, you know,
Yep.
but you compete your own selves before. So that's really wonderful learning for us. And also, thank you so much. So, guys, if you have any questions and you would like to connect with Dr. Mariana Wingood, connect with her. We will going to post her Twitter account and also her email once we featured her on our Balance and Faucet World Group. So check with her works. She's still out in MedBridge. She is in Evidence in Motion. If you are thinking forward in doing doctorate, and also read about her research and everything. So it's me again, Dr. Jenny. Thank you so much for listening. And if you have any concerns, check out questions, connect with us with Fishigen PT and Wellness. And it's my pleasure to serve with you. So it's me, Dr. Jenny. I'm your Vice Chair for the Global Health in Aging Adults Special Interest Group by APTA and your Geriatric Clinical Specialist. All right. Bye for now, guys, and good night. Bye.
Bye-bye.
Thank you, Dr. Mariana. Appreciate
Thank you,
you.
Dr. Jenny.
You're welcome.